Hi, I'm Dr. Neil Thompson, chiropractor at Align for Life, the Isle of Man's Family Wellness Clinic. I'm going to be talking to you today about one simple thing that you can do with your pillow that could dramatically change 8 hours of your day and ensure that you get a much better quality sleep and you wake up much more refreshed and in less pain, especially with regards to headaches or neck pain. So a couple of things I want to point out to you about why the thickness of the pillow is important. It's not just about comfort. We want to make sure that ideally the middle of our head remains in the middle of our chest. Because if it doesn't, what happens is the head now can start to shift to one direction, which pulls the neck into what we call a translated position, either left or right. And I've got a couple of x-rays here just to highlight to you really what happens if the pillow is either too thin or too thick. So we're going to have a quick look at this x-ray over here now. So you can see this is what a normal neck should look like from the front. Should be dead straight. These obviously are the collarbones here, and then the neck here, and this is the head. Now this is a person where you can see the head is now shifting to their right. So we're looking at the spine from behind here. So they're shifting in that direction, which what happens when that does that is it pulls the whole neck toward the right as well. So it's translated to the right, and this creates a lot of pressure and tension, right? Pressure on this side and tension on this side, on the nerves, but also on the discs, the joints, okay, and also creates asymmetrical muscle tone. And this creates a whole host of mechanical problems, but also neurological problems as well. Remember, the nervous system controls everything, and all these nerves that are coming out of here are supplying vital organs, things like obviously your shoulders, arms, hands, okay, fingers, but even things like thyroid, larynx, pharynx, okay, many structures in this area. So it's very important to make sure that the head remains in the middle of the chest and the neck straight when we're sleeping, because let's be honest, we're often sleeping for maybe 8 hours. And ideally you want to be trying to rotate from one side to the other, so you're not always lying on the right side and not always on the left. Alternating is best. Now some people just prefer lying on the back. That's great, but then no pillow, because remember, if you've got a pillow behind your head, it just pushes your head forwards. And remember, forward head posture, as we covered in previous episodes, creates a whole host of problems as well. So if you do prefer lying on your back, just put up a little bean bag or little rolled up towel just in the base of the neck just to keep the arc there. But if you're on your side, make sure that pillow is the right thickness. So get someone to check your posture, or just have a look at it in the mirror and see if you can identify those patterns. So if you've got anything like this going on, or this, okay, or this, all right, chances are you've got a problem with your pillow, and or maybe it's your workstation as well. You're constantly leaning to one side, so that's also something you can look at. So going forwards, whilst changing your pillow can be really helpful in helping reduce further problems in the future, if there's already an issue there, it's unlikely changing the pillow alone is going to be able to correct that, because there's been a history of probably years, even possibly decades, of this kind of translational problem building up. It's going to normally need additional help and correction to normally address that. So that's my top tip for today. Hope you found that helpful. If you've got any comments or questions, please don't hesitate to ask us. You know, we're always here to try and help out. Take care, have a great week. Bye for now.